Good afternoon, everyone. Thank you very much for attending Southern Maryland Centers for Independent Living annual report meeting. Today, we will be reviewing the activities and accomplishments of Southern Maryland Center for Independent Living during the fiscal year 2023, which covers the period from October 2022 to September 2023. My name is Lydia Beliowska, and I'm the Executive Director of Southern Maryland Center for Independent Living, or SMCIL, as we will refer to it for short. Let me tell you a little bit about us. So SMCIL is an independent, non-residential, nonprofit, community-based human services organization created by and for people with disabilities. We serve residents of Charles, Calvert, and St. Mary's counties, and we are an advocacy, information, and educational center that promotes independent living and empowerment for people with all types of disabilities and of all ages. As required by law and strongly adhered to by SMCIL policy, is that 51% or more of our board members and employees are persons with disabilities or parents or guardians of persons with disabilities. So with that in mind, we are still an independent nonprofit, like I mentioned, and we are governed by our board of directors. They guide us and support us, our staff, to provide amazing services and programs to our consumers. We call the individuals that we serve our consumers, and all that we do is centered around them. It is my pleasure to introduce to you our current board of directors. Christina Bishop is our president. Julie Randall is our vice president. Penny Brueggemann is our treasurer. Mr. Phil Horn is our board member. And Ms. Robin Cavallaro is our newest board member. And this is our amazing staff. As I mentioned, I'm Lydia Beliowska. I'm the executive director. Pamela Ford is our deputy executive director. Arcelis Torres is our office fiscal administrator. Mr. Jerry Taylor is our peer coordinator and veteran support specialist. Stacy Tobin is our assistive technology and independent living specialist. Takia Thomas is our IL specialist as well. Geronda Montgomery is our supports planner. And Riley Guarnero is our supports planner and social support specialist. Thank you all for your dedication. We could not do this without you, and you are the heart of this agency. So you can go on, Stace. Stacy will present some of our core services and additional programs at this time.
Thank you. My name is Stacy Tobin, and I am, as Lydia said, the Independent Living and Assistive Technology Specialist here at Southern Maryland Center for Independent Living. We have 5 core services that we provide to our consumers. The first is our individual and systems advocacy. So we advocate for improved accessibility, equal civil and human rights on an individual and systemic level. In doing that, we provide self-advocacy training and we offer disability awareness training to community groups and businesses. Our second core service is peer support. We connect people with disabilities in a one-on-one or group setting to peers and mentors with like disabilities to serve as a role model and or support system. Another of our 5 core services is independent living skills training. This enhances and maximizes the ability of a person with a disability to live in and participate fully at home and in their community. So some of the things that we do to train them is we work on budgeting, we teach them cooking skills and nutrition, travel training, communication skills, household management, stress management, among a wide variety of other skills trainings that we do. We also have information and referral. We maintain an extensive database of providers and resources on disability and community-related information for our consumers, and we provide disability-specific information and referrals to ensure access to the knowledge needed to receive and or maintain independence. And our 5th core service is transition. Transition services assist consumers who are in various phases of transition, including but not limited to transition from the penal system, rehabilitation programs, shelters, and homelessness. One of the specific programs under this core service is our Transitioning Youth Program, or TY. It focuses on school-age individuals transitioning into productive, active, self-sufficient, independent adults. So we help them in transition from high school to college, work readiness. We work with them on benefits and health management, educate them on conflict management, and ensure a connection to services that will promote independence. We also have our Money Follows the Person, or MFP program, and it focuses on transition from an institution such as a nursing or rehab facility back into the community. We have our MFP coordinator is Mr. Jerry, and he informs residents about the Medicaid waiver programs available to help them with this program, with this grant. And he insists individuals who have that full Medicaid insurance and meet the certain qualifications to transition with the necessary supports in place. We also have some additional services and programs. Our staff can help individuals with Social Security benefits. So we have access to SSI and SSDI forms. We assist with initial applications and the appeals, and we advocate for them to get their benefits. We provide benefits counseling, so we educate Social Security beneficiaries about the various incentives that are available that will help them to be employed while continuing to receive their monthly benefits from Social Security and then transition to self-sufficiency. We also provide job search and readiness, as well as perform other application assistance as needed. Back to you, Lydia. Lydia, are you able to unmute?
Give me a second. Thank you.
Sorry.
So in fiscal year 2023, SMCIL served 270 consumers, and we define a consumer as an individual with a disability that limits one or more life activity, who has at least one goal and has requested at least one service. We also provided 339 information and referral services. Those are services provided to active consumers, as well as anyone requesting disability-specific information or referral. It can be a family member or just anybody in the community. We served in 2023, we divided, show here a chart of our consumers served by county. So we served 47 consumers from Calvert County, 103 consumers from Charles, 115 consumers from St. Mary's County, and 5 consumers under other, which in this case were consumers from PG County, Prince George's County. They were either veterans who requested services that the Centers for Independent Living in their area didn't provide, or a staff member from a center for independent living in Prince George's County, since SMCILs cannot serve their own staff, so they refer them to the closest staff. As far as by disability, we served mostly individuals with multiple disabilities. As you can see here, 47% of our consumers had multiple disabilities. Another large portion of our consumers had physical disabilities, 30%, and then smaller percentages for the hearing and vision impairments, cognitive, mental, emotional disabilities. We also have 17 consumers under other, which is a category that if the disability didn't quite fit in any of the above categories, it can be something like a rare medical condition or a disorder that would fit into that category. So let's talk briefly about our consumers that we served over the 5 years, just a comparison. Back in 2019, we served 271 consumers, similar to this year. In 2020, we served 266 consumers. In 2021, 225 consumers. 22 were 233 consumers, and we're back up to 270 this year. So just a little comparison for you guys to see the flow over the years. So we wanted to talk a little bit about our support system, or our network, like we call it. We are part of a nationwide network of independent living centers. We're actually one of 7 centers that are in the state of Maryland. Our center serves St. Mary's, Charles, and Calvert counties, like I mentioned earlier. We are, again, nonprofit, independent, and non-residential agency. And we're also supported by the Maryland Statewide Independent Living Council, or Maryland SILC for short. In the pictures on the right, you can see some of our staff members and the SILC members at the National Independent Living Council conference in Washington, D.C. last summer, where we marched towards the Capitol and we advocated on behalf of our consumers in front of our legislators. So that was a great event, a great week, actually. And now Ara will talk to us a little bit about our funding sources.
Good afternoon. My name is Ara Torres, and I am the Fiscal Administrator for SMCIL, and I will be sharing some information about our finances for fiscal year 2023. SMCIL has a variety of funding sources, and we receive funding from multiple federal, state, local, and private sources. For example, DOORS, or the Division of Rehabilitation Services, who is our main core grant funder, as well as our designated state entity. HHS, or Health and Human Services, is another of our operational funders. We have also funding from CDBG, or our Community Development Block Grant, and that comes from St. Mary's County, as well as ARPA, which is the American Rescue Plan Act. We receive funding as well from the Maryland Department of Disabilities for the following programs, which is the Money Follows the Person, the MFP grant, and the Maryland Technology Assistant Program, or MDTAP. We also receive funding for assistive technology for supplemental grants, and those come from the St. Mary's County and the Charles County, as well as private donations and donations from organizations and from our fundraising efforts and events. Our next slide shows a comparison of our finances over the last 3 years. For our income comparison, for fiscal year 2023, we approximately reported $510,000. For fiscal year 2022, approximately $434,000. For fiscal year 2021, approximately $457,000. And we have a projected income for fiscal year 2024 of $630,000. For our expenses, for fiscal year 2023, we are reporting approximately $509,000. For fiscal year 2022, approximately $434,000. For fiscal year 2021, approximately $431,000. Please note that these numbers are subject to adjustments and closing entries during our annual fiscal review. On the next slide, this chart shows a breakdown of our income categories for fiscal year 2023. Our core services grants represented 47% of our total funding. Assistive technology grants totaled 21% of our total funding. COVID-19 relief grants represented 18% of our total funding. And case management grants totaled 9% of our total funding. Note, this category includes the following: our SPA, which is our support planning agency, the VDC, which is our Veterans Directive Care, and HUD 811, which is a housing case management program. Next slide. This chart shows the breakdown of our expense categories for fiscal year 2023. Salary and benefits represented 62% of our total expenses. Additional operating expenses totaled 17% of our expenses. Assistive technology and pass-through funds totaled 13% of our expenses, and COVID-19 relief purchases represented 4% of our expenses. And now we move on to Stacy, who will speak more about our assistive technology programs.
Thank you, Ara. Assistive technology is one of our big programs here at Southern Maryland Center for Independent Living outside of our 5 core. We have a grant made possible through the Department of Rehabilitative Services, in which we get a little over $52,000 in pass-through funds that go directly to benefit the consumer by building ramps, modifying bathrooms, modifying homes, and purchasing equipment. About $15,000 of that goes to our operating expenses. And in fiscal year 23, we served 24 consumers with various forms of assistive technology. This slide shows the various forms of technology that was purchased in that fiscal year. You can see we purchased 2 lift chairs, 5 sets of hearing aids, 2 scooters and a scooter lift, a stair lift, 7 permanent ramps, a modular ramp, a Hoyer lift, an air purifier, grab bars for a bathroom, a total bathroom modification, some bed rails, a rollator, a walker, a magnifier, and some keys you can see keyboard. And here's a picture of a few of the projects that we did. You can see one of the ramps that we built was quite extensive. The grab bars that were placed in one of the bathroom modifications, a scooter that was purchased, as well as a stair lift that was placed in a home for one of our veterans. This slide shows our partner agency collaborations specifically for our assistive technology program. These additional grant funds and labor help to extend the AT funds we received from DOORS and satisfied the 20% in-kind contribution requirement. You can see that both Charles County and St. Mary's County delivered grants. Charles County gave us $10,000 and St. Mary's County gave us $6,000. We got a small grant that helps with consumers in Calvert County through the ADF Community Foundation grant. And then we do work with Christmas in April here in St. Mary's County. And we did projects where they donated labor worth over $23,000. We also have our statewide portable access project. It's a ramp loaner program in partnership with the Maryland Technology Assistance Program, or Maryland TAP. It was established through a grant to the state from the Christopher and Dana Reeves Foundation to the Maryland Department of Disabilities Technology Assistance Program. We house 10 ramps ranging from 4 feet to 12 feet and an adjustable threshold ramp. They are loaned out for a period of approximately 120 days to residents in our jurisdiction, both Charles, Calvert, and St. Mary's counties. And the purpose is to allow these consumers accessibility to their homes while a more permanent solution is worked out. The loans can be extended if there is not a wait for that size ramp, and we have done that for several consumers. We were successful with this partnership this year and assisted 7 consumers with loans during this fiscal year. We also have our assistive technology loan library. It was created in 2018 via a grant, and it was established to enable individuals with disabilities to live, work, and learn more independently through assistive technology by allowing the consumer to see and try the latest AT prior to purchasing. Every year, we expand the library and add new items. So you can see the wide range of categories of things we have in our library. We have an adaptive dining equipment so that it can help people with eating. We have sensory aids, learning devices, listening devices, visual aids, memory aids. We have iPads with software, communication devices, computer programs, and so much more. Our library is open Monday through Friday, 8 to 4:30. We do request that consumers make an appointment before coming in so we can be sure one of us is available to demonstrate the items. We can also do library tours. We do loan these devices out on short term, and we do trainings and presentations and provide information and referral. We also have the iDrive and the AT Financial Loan Program, or ATLP. This is a new program that started in fiscal year 2023, where we became regional ambassadors, spreading the awareness and referring Marylanders here in Southern Maryland with disabilities to the AT Financial Loan Program. That program provides low-interest loans to Maryland residents with disabilities or their families who cannot otherwise afford a loan, but are still capable of maintaining a good likelihood of repayment. The loan covers all types of AT, including vehicles, computers, hearing aids, home modifications, and so much more. iDrive, which is a component of this program, allows Marylanders with disabilities, particularly those in a rural area, such as ours, who are likely to face limited access to transportation, higher poverty rates, and greater unemployment, to get a loan for both adapted and non-adapted vehicles. We started this program in January of 2023. We presented the iDrive program and the Assistive Technology Financial Loan Program at 12 outreach events and presentations, and we had 3 consumers referred for further assistance. We also have our housing case management. This is a program that started a couple of years ago, and we have continued to support 3 consumers and 1 family in accessible housing through HUD 811 at Calvert Hills Apartments. And we have 2 consumers that are up here in St. Mary's at Patuxent Crossing. We, along with our sister SILs, negotiated last year a contract so that we would get a fee for service for providing this case management services that we had always been providing to HUD 811 participants. And we currently have 33 consumers on that wait list, with one pending approval for leasing up in a unit in Anne Arundel County. We do know that there is a complex that it will be a ground up build in Charles County. I'm not sure if they've broken ground yet, but the hope is that within the next year, we will have individuals leasing up and joining our program from there. We have the Community Development Block Grant, known as CDBG, and the Americans with
I
Rescue.
think Pam can do this one.
Is she here? Awesome, sorry.
Yeah.
I hadn't gotten a message. Well, Pam?
Good evening, everyone. I'm Pam Ford. I am the Deputy Executive Director for Southern Maryland Center for Independent Living. I am glad to be joining you today. And as Stacy was saying, we have the Community Development Block Grant, which is called CDBG, and also the American Rescue Plan Act, also known as ARPA, as Ara referred to earlier. And as a part of the COVID relief efforts, SMCIL was awarded grants, which is the CDBG, which is from St. Mary's County, and ARPA, which is from Charles County, to assess and evaluate communication barriers that took place during the pandemic. Our assessments found that barriers were related to lack of ability to use various communication devices. The grants then afforded SMCIL to purchase the communication devices and train the consumers on their devices to alleviate the barriers. Our ILS specialist, Takia Thomas, completed 3 presentations to a total of 60 individuals. We purchased laptops and provided those laptops along with the needed accessories to help our consumers to use those devices, such as mouses, as well as carrying cases. The IL specialist also provided group trainings as well as individual trainings to ensure that they were able to use the devices to the best of their abilities. We also have a Disabled Veteran Support Network group. This is a collaborated effort with NAB Vets who utilizes our Veterans Training Center to submit veterans claims. We continue to provide all veterans application assistance with claims, peer mentoring, self-advocacy, and computer skills training. We provide support has been provided via phone to all members and new veterans to accommodate those who are still uncomfortable with in-person meetings post-pandemic. In-person support meetings has restarted at the end of FY 2023. Here we have pictured Lydia and Jerry Taylor, who is our veteran guru. We also have a Veterans Directed Care Program, or our VDC program, which is administered through the Maryland Department of Aging, MDOA, and the Veterans Affairs Maryland Health Care System to deliver home and community-based services to our disabled veterans who qualify for the program. SMCIL was approved to provide case management services through the VDC program in mid-FY 2022 on a fee-for-service basis. Our jurisdiction for this program covers Calvert, Charles, and St. Mary's counties, and we have served in FY 23 3 veterans. We were also awarded our supports planning agency and continue to provide a fee-for-service subsidiary of SMCIL. The SPA, as known as Supports Planning Agency, provides comprehensive case management and supports planning services to individuals who are approved for Medicaid long-term services and supports. Our supports planning agency's jurisdictions covers Anne Arundel, Calvert, Charles, Prince George's, and St. Mary's counties. We have one part-time supports planner, who is Geronda, and in September, we added a second supports planner, who is Riley. Per our contract, our SPA is operating at a maximum caseload of 55 participants.
So SMCIL does have a bus. We've had our bus for 5 or 6 years now, and we use it to transport consumers to our services here at the office as needed. But we also use it to transport individuals to outreach events such as the Solomon's Dragon Boat Festival and Retrofest on the Potomac. We also manned a table at Retrofest on the Potomac to provide information about SMCIL services to the attendees. We also this year got to transport seniors in Charles County from the Nanjeboy Senior Center to the Scam Jam event in Waldorf. Our staff participated in 11 outreach events throughout the year, presenting our information and services to the attendees and also handing out some wonderful giveaways. You can see here our bus pictured, as well as Lydia at the Retrofest and our table with information and our giveaways. This slide represents our accessible sailing experience. We were able to provide a very unique social experience to our consumers, a total of 23 consumers between 2 events on July 18th and September 27th. We transported them via our bus to the Chesapeake Regional Accessible Boating in Annapolis for a 2-hour interactive accessible sail. You can, in the pictures, are both groups for the 2 days that we went, as well as pictures of them on the sailing. And in these, you can see different consumers of varying ages and varying disabilities. We even had an individual who was in a wheelchair who was able to be lifted into the boat using an accessible Hoyer lift, and he was secured via special seat and harness. And all of the members that came with us, all of our consumers that came with us, were able to participate and actually interact with the sailing. They got to all do some part of the sailing activity. And then after the sail, we loaded back up on the bus and we traveled to the local park, Quiet Waters, where we were able to eat a box lunch that was donated to us by Apple Spice Junction. So I was very excited to provide this new social opportunity for some of our consumers this year.
Thank you,
Lydia?
Stacy. That was truly an amazing experience. I got to sail for the first time as well, so it was amazing. So thank you, Stacy. Thank you, Pam and Ara, for going in detail about our programs and activities. I just wanted to summarize some of our accomplishments for the last year. As Stacy mentioned, we increased our assistive technology library activities, including the loans and demos, and continue to collaborate with Maryland TAP, as well as negotiated a new contract with them for the next fiscal year. So we're excited to continue this effort. We began the iDrive Assistive Technology Loan Program promotional efforts in January of 23, and we presented over 700 people at the combination of 12 outreach events or small group presentations. So we believe we reached a lot of individuals with that information. And we will continue to do so in this year. We continue to support our consumers who reside in nursing facilities through our Money Follows the Person program. We went back to in-person visits, so we were able to visit with the social workers and the residents in most of the facilities whenever they were open and didn't have an outbreak. We continued our COVID relief efforts through the CDBG and ARPA grants. We believe that we improved access to technology and communication for our consumers. There's another effort that we worked on during the year, the Public Health Workforce Grant, which was funded through the Administration on Community Living, or ACL. They extended us additional federal ARPA funds. We were able to hire a social support specialist, who is Riley. She's serves in a dual capacity as a support planner and a social support specialist. And she gathered resources and information for consumers that they can use in future health emergencies should they arise. We provided a unique social opportunity through the partnership with CRAB that Stacy just told you guys about. They participated in this interactive adaptive sailing experience, which was amazing. We heard only good things from them afterwards, and they're excited for next summer. We also negotiated a fee-for-service program in partnership with our sister SMCIL in Maryland through the Maryland Department of Disabilities to support case management efforts with the HUD 811 housing. And we are very proud of these accomplishments. Since we do everything with our vision and mission in mind, I wanted to revisit our vision and mission. We envision a society in which people with disabilities are valued equally and participate fully. We advocate for equal opportunities for people living with disabilities, and our advocacy work is driven by the needs and desires of the people we support. Also, our mission is to empower people living with disabilities through services and advocacy with the tools to lead self-directed, independent, and productive lives. We live by these words, and we truly try to follow those that vision and mission. So these are some of our plans for the next fiscal year. We would like to continue to build the supports planning agency and increase our caseload capacity, as well as expand the public health workforce within the disability network in our community through the ARPA funds that I just told you about, to gather resources, information, and disseminate it to consumers to use in future health emergencies. We will increase the reach of our awareness and marketing efforts in the community by utilizing social media, website, different events that we attend, trainings, presentations, and a lot of our personal contacts. We'll strive to capitalize on those fundraising and donations through a new donor management program that we subscribe to. We will continue to expand our assistive technology programs and renegotiate our contract as regional ambassador for the AT loan program and iDrive in partnership with Maryland TAP. I'm happy to say we were able to do that, and we are about to start the new grant cycle next month. We will continue to provide case management services per the contract for HUD 811 housing case management through Maryland Department of Disabilities, and hope to grow that with the new developments in Charles County coming up. We continue to provide technology and training under the CDBG and ARPA grants. We will also enter into a new 5-year memorandum of understanding to participate in Maryland State Department of Education's Disability Innovation Funds, or DIF, Pathways to Partnership Initiative. We will work within Charles County Public Schools, and the goal is to transition students with disabilities through their high school journey to post-secondary life. That is a completely new initiative that we are very, very excited about. We will also increase efforts to recruit new board members and grow our board, and we plan to have a board retreat by the end of fiscal year 2024. So in the next slide, you can see our contact information. You can reach us by phone, of course, through our website, our Facebook page. You can email us on our info email, or you can also email our staff directly on their emails, which are listed on our website in their profiles. So thank you so much for attending this presentation. We're glad that you were here, and we're grateful that you are supporting us, and thankful to all our consumers, our staff members, our board members, our provider partners, and grantors, and of course our partner agencies. Thank you very much, and have a great afternoon.